Good evening. Was it a blip or the start of a second wave? One day after the province reported more than 300 new coronavirus cases, everyone here at Queen's Park was keeping an anxious eye on those daily COVID numbers. And opposition leaders were pouring on the heat, pressing the Ford government for a response to the sudden rise in infections. We begin our coverage tonight with those numbers. Health officials are confirming 251 new infections today, down from 313 yesterday, which was the highest daily total we've seen since early June. The 5-day rolling average now sits at 243. 1 month ago, it was 81. Meanwhile, Ontario's death toll has grown by 4. 5 health units are reporting double-digit caseloads. Toronto, Peel and Ottawa have been hotspots for weeks now. But both the York Region and Waterloo are also reporting a small spike in cases today. More than 27,000 tests were processed, and 0.7% coming back positive. Another 24,000 samples remain in the backlog. Hospitalization numbers remain low and stable, with the majority of cases being among people under the age of 40. And today, Premier Doug Ford said he'll have an announcement on the hotspot regions very soon. A government spokesperson tells me they're looking at clamping down on large gatherings on private property, where they say a lot of the new cases are coming from. And they're not looking at rolling back to stage 2. Another very big concern, though, is long lineups at assessment centres, as the Premier continues to warn a second wave is on its way.
This virus, it's a terrible threat, and the officials are telling us that the second wave could be more complicated than the first one.
Testing is one of the pillars of battling COVID-19, but Ontario's assessment centres are being strained just as children go back to school. Long lineups that can last up to 4 hours stretch around many centres. St. Mike's Hospital tells CityNews in July they performed an average 203 swabs per day. But in the past 2 weeks, on higher volume days, the average went up to 326. That's a 60% increase. Premier Ford suggested today pharmacies could be used to ease the surge.
We have to make sure all the ducks are in a row, but making sure that say symptomatic tests through these pharmacies, and it'll take the burden off the other areas that have potentially a lot more ill people.
The government is promising to release its fall plan in the coming weeks and days to deal with the second wave, but the opposition is calling for it now.
How does this government expect families to believe that they have a plan for the second wave when their current plan is actually unraveling before our eyes and exposing students, parents, and education workers to the virus?
The government's website lists 14 new school-related COVID-19 cases in the past 24 hours, with 27 schools reporting outbreaks. Keep in mind, there are close to 5,000 schools in the province, but most have just started reopening. So it raises the question of what the government plans to do in a worst-case scenario.
Is there a contingency in the fall plan that if indeed the second wave is coming, as the Premier stated yesterday, that schools would do 100% online learning?
If we need to do that in the context of going remote, the province will do whatever it takes to make that transition.
The Education Minister also said today that if outbreaks happen, they could send in mobile testing units to high schools, but not elementary schools, because parental consent would be required. As for long-term care, the minister in charge says she doesn't want to roll back visitation. She'd like to properly train family members in COVID safety instead. And I found out today hospital capacity across the province is on average at 87% versus around 65% when hospitals were cleared out to prepare for a surge in the early days of the pandemic. Even though hospital COVID cases are currently low, they'll need extra capacity in case of a surge. And don't forget, flu season is coming.